Hello everyone, I'm Dr. Abhilasha. I'm working as Pediatric Oncologist at Kali's Dr. Prabhakar Kore Hospital, and I'm also Professor in Oncology at JNMC Belgaum. So many people find it hard to believe that even children can suffer from cancer. But the fact is, if we take our own country, more than 70,000 cases of pediatric cancer are diagnosed every year. And in past six and a half years at this small district place, Belgaum, we have treated almost 400 cases of pediatric cancer. And the good news is, as far as cancer treatment in children is concerned, the treatment outcome is very good. More than 70 to 75% of these children can be cured if it is diagnosed timely and these patients receive good care and proper treatment. Now, as far as cancer treatment is concerned, chemotherapy forms an integral part of cancer treatment. Especially in children, the commonest malignancy is leukemia, that is blood cancer. And chemotherapy is an integral part of leukemia treatment. The other solid tumors, there it is multidisciplinary treatment which involves chemotherapy plus surgery, radiotherapy. So chemotherapy is a part of treatment of almost every cancer in the pediatric age group. Now people generally fear and dread when they hear this word chemotherapy, and they often ask, what is this chemotherapy? This has so many side effects. It's better not to go for treatment when my child is going to have so many side effects due to chemotherapy. No, that's not the fact. There are a lot of myths about chemotherapy as far as pediatric age group is concerned. In fact, children tolerate chemotherapy very well, unlike adults. Their tolerance to chemotherapy is good. Yes, there are few side effects, but we can easily deal with them. Now, once a child has received chemotherapy, the treatment outcome depends to a significant extent on how these children are looked after, taken care of after the chemotherapy is over. Because once they receive chemotherapy, their immunity goes down. This chemotherapy is mainly meant to kill the cancer cells, but it also affects the normal cells of our body, like the white blood cells, the red blood cells, the platelets, our skin mucosa. So even these cells can be affected and the immunity goes down significantly. So as far as care of the child in the post-chemotherapy phase is concerned, there are three important aspects to it which have to be given very good importance to make sure that these children do well. Now, first and foremost is hygiene. Hygiene is the most important aspect after chemotherapy. These children should be very clean. They should follow good oral hygiene. They should wash their hands, and even the caregivers should wash their hands frequently with soap and water. Now, when it comes to food, they should prefer only freshly cooked food. One should avoid stale or any form of refrigerated food or outside or street food. That has to be avoided. Even non-vegetarian food which is not cooked properly should be avoided. Water they should use only filtered and boiled water. Boiled water which is filtered once it is boiled. So it should be clean. They should not have canned juices which is not fresh. So they have to follow something known as neutropenic diet. So what exactly we mean by neutropenic diet? As I told, it should be freshly cooked food, and when it comes to fruits and vegetables, they have to avoid raw vegetables, and even fruits, the ones which do not have thick peels, like grapes, chiku, kiwi fruit, which everybody is very fond of. These fruits have to be avoided. The ones with thick peel, like orange, papaya, these are banana. These are the preferred fruits which they can have. These children should wear masks, especially if they are going out, as they are susceptible to airborne infections as well due to their low immunity. Another important thing is that they should always avoid crowded places. They should not go to crowded places like theatres or shopping malls or fun fairs. Even at home, if somebody is suffering from upper respiratory tract infection like cough and cold, those people should not come near this child who has just received chemotherapy, as they can catch infections. Also, too many visitors should not be allowed near the children, as they can pass on the infection. This is avoiding crowded places are wearing masks is another very important aspect of care of children suffering from cancer. Nutrition is very important aspect in post-chemotherapy. It has been found that if the serum albumin level, to put it in simple words, if the nutritional status is good, then they tolerate chemotherapy very well and they have less chances of infection. So they should eat properly. Post-chemotherapy, they do have nausea, vomiting, but usually the oncologist prescribes the medicines, antiemetics, so that they don't feel nauseated. And even if they have little nausea, they have to eat. If they can't eat a good amount at one time, they can have small frequent meals according to their taste. They have to be very well hydrated, because if they are not well hydrated and if they have mucositis, then they can have a lot of complications. Mucositis means a small oral, they can have some oral ulcers. So that has to be brought to the notice of the doctor immediately. Now, after hygiene and nutrition, the next important thing is knowledge about the red flag signs or the warning signs. These are the danger signs which they must be aware of. That is when they are supposed to visit their oncologist, treating oncologist. So one should always follow the instruction of the treating oncologist. They should follow up regularly as per the instructions. And if they notice that the child has developed one of these symptoms like high-grade fever, they should not just give paracetamol and sit at home. They should immediately rush to the hospital, because they need to be administered intravenous antibiotics, as these patients are likely to be neutropenic, that is, they have low WBC count, and this is an emergency. So this is not like fever in other children. This fever is an emergency. If it is not addressed immediately, they can develop complications like septic shock, which can be life-threatening. Second, if the child is having diarrhea, the parents are noticing that he is getting dehydrated, they should immediately rush to the hospital. If there are other warning signs like breathlessness, if the child is breathing very fast or is having severe pain abdomen, if the child is looking pale, it means that the hemoglobin has gone down, or if there is any internal bleeding, if they notice any bleeding manifestations like bleeding from the nose, if the child is passing blood in the stool or urine, that is a warning sign, and they should immediately rush to the hospital so that life-saving interventions can be done at the earliest. So if we take care of all these aspects after the child has received the chemotherapy, then definitely the outcome is going to improve. And it is a very important aspect. As I mentioned earlier, pediatric cancers are curable provided they are diagnosed early, treated appropriately, and post-chemotherapy care is optimal. So let's be positive and give our best to these children. Thank you.